Good afternoon and welcome to today's webinar. We're thrilled to have you join us for a conversation that is not just timely, but incredibly crucial. My name is Spencer Smith and I'm the Director of Marketing here at Upside. At Upside, we're on a mission to redefine how we approach the aging journey with a particular focus on housing stability. We believe that housing isn't just a roof over your head, it's a cornerstone of well-being, especially for our aging population. The subject of housing stability is increasingly coming into the spotlight, particularly as it relates to older adults. There's a growing awareness, and many are starting to recognize its importance. However, there's still a disconnect between awareness and meaningful action. That's the purpose of today's conversation, to bridge that disconnect and explore actionable solutions. And who better to lead us in this conversation than Jake Rothstein? Jake is an age tech innovator who has been passionately addressing the challenges facing older adults for over a decade. He's the co-founder and CEO of Upside and previously founded Pop-Up, a groundbreaking service that pairs older adults with Pop-Up pals for companionship and assistance. Jake's work is fueled by a unique blend of compassion, innovation, and relentless drive to improve the lives of older adults. So without further ado, let's dive into this critical conversation. Jake?
Spencer, thank you for the kind and warm introduction. It's really good to be here, kind of sharing a little bit about our story and a little bit about the market and the things that we've learned over the last bunch of years working with older adults and their families. I wanted to start today's conversation around kind of the founding story, why we're here, how this is so personal to me, and kind of the reason we've learned a lot of the things that we've learned in this industry. So it really all started with my grandfather. You can see his name is Joseph. He's on the screen here. And this is a guy that really epitomized the American dream. He came here to the United States with really nothing and lived and worked a really beautiful life, raised 3 beautiful kids, built a business. I mean, really the cornerstone of American success. And unfortunately, at 81 years old, he was diagnosed with Alzheimer's. That kind of robbed him of his ability to kind of remember a lot of the beautiful things that he created in his life. And my grandmother, they were married for 65 years, really started to care for him at the beginning of this journey and hid it from a lot of us, which was, part of her, just part of her maintaining her, I don't even know what she was trying to maintain, but she wanted to maintain her cool kind of as she cared for him. Anyway, as she started to care for him, it became cumbersome, and she was very social and very active. And so she would get calls from her girlfriends and, hey, can you meet me at Starbucks, or can you meet me at for lunch at a moment's notice? And she would need help to basically someone to sit with my grandfather and just make sure he was going to be safe and okay. And so at the time I was a traveling salesperson, and she'd call me a couple times a week. Hey, Jakey, can you come over and sit with your grandfather for an hour or a half an hour? I just got to get out of the house. I need someone to babysit him. And I would go over there, and it became pretty cumbersome for me too after a few months. And I remember one day sitting at her kitchen table with him and calling a few home care agencies, like local home care agencies here in the Miami area, with a simple request. Hey, can you send a caregiver over to, actually doesn't even need to be a caregiver because my grandmother cares for him, but can you send a person over to sit with my grandfather and just make sure he's okay for a little bit at a moment's notice for an hour here, an hour there? And of the 5 places I called, I remember vividly, I got laughed off the phone 5 times. And kind of the excuses were universal. You need 20 hours a week minimum. That's how our caregivers work. And he needs to be on a set schedule. And what kind of care does he need? And I'm like, well, he doesn't really need care. And my grandmother's schedule really doesn't work on a 20-hour-a-week schedule like that. So everything's kind of impromptu based on how her friends call her. Long story short, started a business in the space. We called the company Papa to deliver companionship and loneliness abatement to millions of people, starting with my grandfather. Worked with my cousin Andrew on it, and Papa grew really fast and we learned a lot as that business grew. And sort of while that was all happening, something was going on with my grandmother as well. At some point, she stopped being able to care for my grandfather altogether. It just became physically too cumbersome. And so family got together and we decided, let's move my grandfather into a senior living community, a memory care facility to be specific. And that was a rough transition. But for the first time in my grandmother's adult life, she found herself completely alone at 87 years old. And she didn't need a lot of the care and the support that he needed, or the care and the assistance really that he needed. But what she did need was that support, was the help with the grocery shopping and help paying the bills. And she was living in this 2-story house that she couldn't navigate anymore because she had recently had knee replacement surgery. And so again, the family got together and said, well, she can't sustain living in this house anymore. And she didn't know how to pay the bills. She didn't know how to maintain the place. And she was also paying a tremendous amount of money for his care in his senior living community. So we got together, we made the decision to sell the house, downsize her, move her into an apartment in the same neighborhood that she knew and she loved, and that was near her grandkids and her doctors and her family and her friends. And what we realized that, much like my grandmother, there was millions of people like her that were at some point along this aging journey couldn't stay where they were. And as we sort of progressed here and we dealt with the challenges that my grandmother faced, we realized that aging is really a journey, and it's unique and specific to each individual, and it's peppered with these transitions, these kind of events that happen from the time you're born to the time you die. You go through these transitions, and they get particularly more difficult as you get older, when you are able to do less things on your own, and that these transitions affect everyone a little bit differently, and that they happen more frequently as you get older. And so as we get older and these transitions identify themselves as what we like to now call trigger events, they cause this necessity for someone to have to make a change. And so we've sort of come together as a society over the last bunch of years under this premise, this idea of aging in place, right? This aging in place. When surveyed, 90% of people say that they want to age in the same place they raise their kids in. But what we found is that trigger events cause the necessity to move at some point along the aging journey. And we've bucketed them here into what we call the 5 Ds, or 5 trigger events that fall into these categories. Death of a spouse is a common one. Disaster, you see the hurricanes in Florida or the wildfires in California. You can have the need to move or to transition very rapidly and kind of out of the blue in many cases. Disability, like my grandmother, she could no longer walk up and down the stairs because of her knee replacement. Now she had built this house for retirement that she was supposed to age in place in, and all of a sudden that became really impractical, if not impossible. Gray divorce, they're calling it gray divorce. It's becoming more and more common. People over 65 are getting divorced in much higher numbers than ever before. And of course, downsizing. There's a lot of people that come to the realization at 65 or older that they don't need that extra bedroom, or they don't need that big yard, or they want to be closer to their grandkids or their kids across the country. So these transition points are really one of the biggest problems that is impacting individuals, and as a result, health plan members, if these members are individuals. And a lot of times, in most cases, what we're finding is that these transitions are going unnoticed. And so when we say this is the biggest problem you have, what we're saying here is members are suffering in silence as they go through these transitions, and that these transitions in housing, as they relate to housing, they impact all of these other things. If you're not in an appropriate environment, in a safe and stable environment, how are you supposed to get appropriate nutrition delivered appropriately, or social connectivity? We had a case where one of our members was living in a place where their microwave broke, and she never told anybody. And so she couldn't heat up her food in a sustainable way, and she was getting bad nutrition. And she wound up moving into one of our units, having a working microwave, and nutrition suddenly wasn't a problem anymore. So little things like this that are all tied to this core of housing have the ability to impact all of these other social drivers of health that we put a lot of emphasis on. But we say members are suffering in silence. What do we mean by suffering in silence? Well, housing-related issues are not showing up in claims. They don't show up in claims. And so in the health industry, in the healthcare industry, so much of the decisions that are made are as a result of claims data and analysis of claims data. And so what winds up happening by looking at only claims is that we're only addressing issues very reactively, and in many cases, once it's too late. And as an industry, I think we've worked really hard at addressing the most vulnerable subsets of the population. And as a result, we're missing this forgotten middle. And the forgotten middle is really critical because it's a very, very big piece of the population. And the second piece to this is not only are these housing related issues not showing up in claims, but in many cases, we're not asking the right questions either. We're surveying, the healthcare industry has a really a very good ethos of surveying and assessing members as regularly as frequently as possible. But in many cases, we're missing things that could impact their stability and their safety. So what we found is that we're asking questions around housing that have to do with imminent financial issues, things like, are you facing eviction? Are you at risk of being homeless? And quality, severe housing quality issues, like, is there mold in your walls or is your roof leaking? And for people like my grandmother, she would have screened negatively for these types of questions all day long. She would not have shown up as a housing insecure person. She was living in a house that she fully paid for. She wasn't at risk of being evicted, and she didn't have mold in her walls. So what we need to be asking, the things that we need to be talking about here, are questions like, is it getting harder to navigate stairs or steps on your porch? Or do you have a lawn or a garden or a pool that's getting tough to maintain? Or when was the last time your air filter was changed? Things like this, these social housing types of questions that are very impactful to housing stability, that create housing instability, not just affordability issues, not just housing quality issues. Those are very big problems and they affect a very vulnerable subset of the population. But if we broaden the types of questions that we ask and the way that we ask those questions, we can uncover so much more of this instability and then actually solve for it. And we've historically missed a lot of these types of issues, these challenges around housing, because we didn't know we needed to capture them. And so this journey for older adults is ever evolving. And as it evolves, the need for us to ask different questions or to ask new questions changes. We no longer live in a time in America where older adults and families stay together. And I think that as the industry has changed, we also have to change. It used to be that, and you can see kind of an evolution of senior living here. It used to be that older adults lived and grew up and died in the communities that they were born in. And their kids were with them and they were there to support them. And you had intergenerational connections that happened naturally within the community. And over the last 50 years or so, we've seen this institutional care model be designed. And it was as a result, largely because of the migration for career opportunities. So kids would move to different parts of the country to chase career opportunities. And the parents, their aging parents, would be, in many cases, left alone without support systems that were necessary. And so in order for us to cater to those older adults and to care for them and to support them, we started building facilities, senior living facilities. And that's kind of how it started. We'd find cheap land in the suburbs. In order to deliver care and services efficiently to an older adult, we put them under one roof, and we put a kitchen in there and a bus in front to take them to the grocery store. And you'd have this homogeneous population aging in a building where family support and intergenerational connectivity were somewhere on the other side of the town or on the other side of the country. And families were separated. And that created a lot of challenges for a lot of people, and it continues to create challenges. Challenges are kind of getting bigger. Recently and kind of today, we've seen that there's been this shift, right, towards personalized, idea of personalized or member-centric care. And we're in a unique position now because of the advent of technology and the acceleration of technological advancements. We're able to deliver groceries to someone's door in 2 hours or take them to a doctor's appointment in 20 minutes. Things like that have enabled us to disaggregate a lot of these services, kind of enabled the industry to serve our customers in a more personalized, or members in a more personalized way. And so the need for just traditional senior housing has kind of evolved into the need for a lot of different types of solutions and this continuum almost of solutions. And the problems that we're all facing, that we've faced since the beginning of history with older adults, they're growing, and they're growing at a ridiculously fast rate because of the demographics that we're facing in America and abroad. But in 2024, 12,000 people a day are going to be turning 65 in America, which means that by 2030, 90 million people are going to be over 65 in the US. And an interesting stat is that only 3% of housing in America today is accessible for people with mobility challenges. 90 million people and only 3% of housing is accessible. I'll kind of just want to emphasize that point. We have a major housing stability crisis on our hands today, and it needs to be addressed really broadly. I read an article the other day about the geriatric care physician shortage. There's about one geriatric care physician for every 7,500 older adults in the US today. So the point here, and kind of the scary point here, is that if we can't figure out a way to move healthcare upstream and to keep people safe and to keep people in environments that we know will keep them safe, we're going to be physically unable to actually care for all of these people. We just don't, there's not enough caregivers, there's not enough clinicians, there's not enough facility, there's just not enough. And the problem is incredibly personal. It's interesting because as we talk to partners and vendors and clients and people all across the country and the world, we're finding that everybody that we talk to has their own story about this. And maybe it's impacting you today, maybe it has already impacted you in some way, shape, or form with a grandparent or parent, or maybe it's going to be you tomorrow that's going to be dealing with these issues. There's not one of us here today or anywhere that's not going to be touched from this type of challenge. And what we're finding is that while the needs are sort of ubiquitous, everyone's needs are kind of unique. The broad challenges are similar, but everyone is unique in these transitions. And it causes major challenges for thousands and thousands of people a day across the country. And again, we believe these challenges in many cases are going completely unnoticed. And one of the things that we found is that there's a massive gap for once you do start talking to families and members, there's a massive gap between what people want and need and what's actually being offered and delivered in the market. One of the things we've learned is this importance of optionality for older adults. Doing anything, interacting, engaging with older adults is particularly challenging because you've got years and years of built up desires and needs and wants and things like that. But optionality, people don't want to feel like they're being pushed into a decision. They really want to feel like they're making a decision, and which means that they want options, all of which might make them safer, but they want the ability to choose from a menu of options that are going to improve their safety and their well-being. They want to feel and retain independence. People want something like a solution they can afford and sustain and be proud of and tell their kids about and tell their friends about. They want someone to listen to them and to be heard and really fully internalize and understand the problems that they face and the challenges that they face. And people want to be met where they're at in the aging journey. Nobody wants to be talked to about assisted living facility if they're still 5 years away from needing assistance. Nobody wants to talk about going into a continuing care retirement community if they're still working a part-time job. So this concept, what we've learned in our tens of thousands of interactions with older adults over the years, is people need to be met where they're at, both on the journey, on the aging journey, and the solutions that are aligned to that place in the journey, but also from a technology standpoint. Everyone talks about technology and older adults, and they're adapting of technology, and they're adapting to it, and COVID's accelerated that, and that's all true. But at the end of the day, the reality is that there's a very widely varying ability for older adults to use technology. It depends on their age, it depends on their background, it depends on their socioeconomic status. And so meeting the older adult where they're at in that journey from a technological standpoint, in that journey from an aging standpoint, is really, really critical. And then finally, people want to stay in their homes for as long as practical. Of course, when you're asked and you're 55 years old and you're of sound mind and body, do you want to age in the place that you raised your kids? Of course, 90% of people are going to say, you would say it, and I would say it. I want to stay in the place that I raised my kids in, except for when one of those things along the aging journey happens, and you have this requirement, this necessity to move, all hell breaks loose. And that's when things get really sticky and challenging and anxiety inducing, and families are brought in, and people make bad decisions if they're not guided appropriately. And what we're finding is that there's so many options out there. There's different services that people don't know anything about, and they don't feel relevant to them, and they're expensive, and they don't know which matches their particular point on this journey, and so they're paralyzed by analysis. There's too much decision making to happen. And when we talk about analysis paralysis, this is kind of what we mean. This graphic on the left, it's different vendors and different categories and different offerings, all of which have their own specific nuances and different meanings. And it's a very challenging environment to navigate for an older adult and their families. And specifically for the families that are helping to make these decisions, they're burdened with their own families. And so we talk about sandwich generation a lot. It's a struggle for people to make these decisions, specifically under the duress of one of these trigger events. And so the market for these services and these housing options for older adults is fragmented. It's confusing. It's this conglomeration of what we've we've started calling point solutions, and our health plan partners as well, they call them point solutions. And these point solutions were built to serve people at different inflection points, different transition points along this aging journey. But for older adults, the current offering in this market is incredibly overwhelming, and it's poorly understood. And there's nobody really walking them through what we call like air traffic control. There's nobody that takes a holistic approach and takes a holistic view and says, here, these are all the options. This is what they mean. This is where you might be at this point in the aging journey, with the full context of the individual and the full understanding of what that person wants and might need. And this matters. This is really important. And it's really important because if you can address some of these challenges around these transitions and provide options that are going to enable stability for people holistically, and you can do it proactively, this is going to have a majorly positive impact on people's health outcomes, on care costs to the health plan, on the organizations responsible for these people's care. It's going to impact everyone in the market. And what we like to think is, as we have this housing first strategy, a housing first strategy really has the ability to do a lot of different things for a lot of different related parties. It has the ability to improve the members' lives. It has the ability for us to reduce fall risk and emergency room visits. It has the ability for us to shorten hospital stays. Health plans, they can realize better member retention and member satisfaction and member acquisition, honestly, by building relationships around housing with members, the kind of the fundamental wallet share of people's lives. You build trust with members. You do it really quickly. You can offer something unique and differentiating. By addressing housing first, you can improve ultimately health outcomes and care costs. I mean, that is really the kind of the key takeaway here, I'd say. All of those other things are really big benefits. But we can actually lower the need for people to receive very expensive care down the line by addressing housing first. And the reason we've been able to do all this, and we can see all of this happening, is because housing is so basic and it's so fundamental. And that's not our idea. You can take this from Maslow. Maslow's hierarchy of needs states that housing is foundational, it's fundamental, and that without appropriate housing, individuals' other needs just simply cannot be met sufficiently. And we've seen the positive impacts that housing has on members' well-being. There's this downstream effect, this ripple effect. And we know that appropriately housed people are happier, they're healthier, they stay with their health plans longer, they feel better physically, and they feel better mentally. And it's just kind of a win-win-win for everybody. And one of the really important things to think about when we're kind of thinking about this major problem is, where do we start? And the starting point we've learned is by asking the right questions in the right way, over the right channels, and at the right times. Asking them at the right times is really important. So I think kind of as an industry, to help sort of tie this up a little bit, as an industry, we need to start thinking about and changing our mindset to be much more proactive and to conduct proper screening and to provide a unified solution that maybe enables options and choices for members to choose from, all of which might make them safer and healthier. Instead of trying to drive or push people to one solution, it's let's assess and let's ensure that we can drive people towards an intervention, not just one specific intervention, but an option of them, optionality of them. We've seen a lot in the market, these programs that are kind of like screen and guide programs or screen and refer programs. What we're seeing is working better than just screen and guide or screen and refer is this concept of screening and intervening, or screen and intervene programs, where you can actually close the loop on a lot of these things. Most case managers or care managers or caseworkers in healthcare organizations don't necessarily have the tools or all the tools in their toolboxes to take people through this entire process and close all these loops. They can't be experts at everything, right? So asking the right questions, asking them at different points in the member's health journey. Maybe it's a proactive phone call. Maybe it's through a provider visit. Maybe it's conversing with a care manager and determining ultimate desires and needs of a family member or friends. Maybe it's meeting the member right where they are in the aging journey. These are things that all need to be thought about and acted upon. We really believe that there needs to be this unified and trusted and unbiased entity that can educate and that can intervene and that can allow people to make these choices for themselves. And we're here to help drive this narrative. We can't tackle this problem completely on our own. We're just we're still a small company, but we're innovative and we're making very big waves and have really big ambitions to positively impact the lives of millions, but we can't do it alone. And so it's kind of on all of us, we believe, to kind of pull together and drive this conversation forward around housing. And just, I want to throw it out there. If there's anyone here on this call that's trying to do something similar or that are currently providing maybe some elements of the things that we've discussed, I'm happy to share some of our experience so far working on this, and see where we can share learnings and things like that. But the kind of concluding here is, when we do all of these things right, we see housing having this massive and hugely positive impact, both on members and for health plans. So I hope the session was informative about what we kind of see as the problem and as this fragmented ecosystem that exists and the need for a more comprehensive, more unified solution in the space. Everyone seems to be talking about housing and its kind of its place as the most important and most studied social driver of health. And we believe that we kind of need to start having this bias towards action versus towards conversation. We've been talking about it. It's really time to start acting on it. And kind of having said that, I'd like to leave you with a few, just if you're going to remember anything from this conversation, kind of remember these few things. Number one, aging is a journey. It's full of transitions. When you think about those transitions, kind of remember that aging in place as we think about it, as we know it today, is kind of a flawed concept because of those trigger events. But really, we should focus on this concept of aging in the right place. And that really is dependent upon where you're at in that aging journey. Number two, the current options for older adults are incredibly fragmented. They're all point solutions, and something needs to be changed there, because point solutions can't deliver efficient and appropriate and timely interventions around people that need it. They're delivered inefficiently. And thirdly, if we don't uncover these problems properly and before they become major problems and they show up in ERs and increased hospital stays and in falls, it's going to be a really, really hard challenge to physically actually care for all the people that are going to need it, with 12,000 people a day turning 65 in this country. So those are the key things that I'd like to leave you with. Really appreciate you all taking the time and joining us here today. I think we got a really good crowd to join. But yeah, I think we can maybe open it up for some questions here. Spencer, are you still there?
Yep. Yeah, Jake, we've had a few questions rolling in. I've answered some directly, and then we'll actually follow up with some people as well, a little more focused on implementation and how Upside is actually working. But a common one coming in, can you share some success stories or a case study where focusing on housing stability has made an impact for members?
Yeah, it's a great question. We have a zillion. Let's see, off the top of my head, I can think of one of our earliest members. Her name's Joanna. She was living in a very small efficiency apartment, and her landlord was, not for affordability issues, but her landlord was kicking her out because he was selling the building. And so 83-year-old Joanna all of a sudden found herself in need to make a transition. This is a woman that wanted to age in place but couldn't because her landlord was kicking her out. And she lived with her two cats that she was now unable to care for as well. Mobility issues were challenging for her. And so she got in touch with us, and we helped her transition into, number one, we helped her rehome the cats, which was a challenge for her. We helped her transition into one of our multifamily communities where her rent was lower than she had been paying before, which was very helpful to her. She was a duals member. And it provided an incredible amount of socialization. This was a person that was living kind of as a recluse. She didn't have a lot of interaction. I think the mailman was her only interaction every day, which she was excited about. And it was a sad situation. She was very lonely. She expressed that to us. And so we moved her to a multifamily community of people of all ages at a price she can afford, because we're able to offer communities at a very wide range of affordability to really match someone's income level with the types of apartments that they need. She lived in the same neighborhood, so she stayed near her, the couple friends that she had and her doctors and things like that. Once she moved in, I remember kind of the first week, our team guided her. There was a taco truck that came to the parking lot of the community that she was in, and we let her know that there was a taco truck there on Tuesdays and Thursday nights. And she wound up getting in touch with us the next day, and she met a friend at the taco truck who they started walking together in the community. This was like the first new friend she had met in years. And her quality of life just completely upended. It was completely positively impacted by this move. And the move was really jarring for her. I mean, having to pick up your whole life at that age she had no family, she had an aunt in a different state, a niece in a different state. And that was the only support system that she had. So leaning on us for a lot of that help was really critical to her. And Joanna's still living with us. She's incredibly happy, and she's one of our first members. It's a cool story to tell.
Great. And Jake, we're getting some more in. So I'm going to go with two more since we're close on time here. Common one. How do you do all of this, and who is actually doing this? And I'm assuming this is referring to Upside.
Sure. How do we do all of this? So we do a lot. So that's a broad question. I can sort of answer, kind of speak to the model a little bit. I think historically we've seen housing programs be, let's build buildings. I mean, some of the bigger health plans can afford to build a lot of these big buildings and house some people. It's not a very scalable approach. A building might house 300 people. So if you have a population of 1 million or 2 million that might be housing unstable at some point in that aging journey, it's very hard to house all of them. So what we've done is we've utilized existing infrastructure. We partner with some of the biggest property management organizations in the country that manage multifamily units. And so we have inventory in excess of 1 million units at any given moment that enable us to place older adults in appropriate settings at any given moment. So, and we built technology that allows us to see the current floor plan of pricing and availability mix across our units in 42 states and 100 different metropolitan areas. So this idea, this scalable model is basically built through partnerships with real estate, and it's essentially a real estate plus services model. We're able to layer services on top of the real estate. Now, as we work with health plans, we started the business in a direct-to-consumer fashion, where we were just placing people in apartments. Now, as we broaden our scope to work with health plans, and we are working with health plans in markets all over the country, we're seeing that we had to build a more comprehensive kind of suite of solutions. So there's people that might not be ready to move yet, but need some sort of housing intervention around safety and stability. So we'll go in and do an in-home safety assessment. We'll put in shower grab bars or threshold covers. We might work with a local community organization to do that, or if a health plan already has that benefit in place, we can do that. So we're leaning on a lot of existing infrastructure to help us facilitate and coordinate this housing stability benefit or housing stability program. But we are acting as this unified and single point of contact and single point of entry for the member. And that's been what's really, really impactful for members, and impactful for our ability to scale this type of program, if that makes sense.
Great. Yeah, Jake, it looks like housing stability is of great interest. We're getting a bunch more questions coming here. So final one, and then we can wrap up. If housing stability is so crucial, why don't you think more health plans or organizations are focusing on it currently?
That's a really good question. I think there's sort of waves that we ride in the healthcare world. We saw it with loneliness. We're seeing it now with sort of food insecurity, or the food is medicine movement. We are of the belief that housing is next, and it's possible that there just wasn't a really good solution for this problem before now. But we're starting to see in our conversations with health plans across the country, housing is becoming more and more talked about, and this idea of this missing, forgotten middle is becoming more talked about. We've always focused on the most vulnerable as it relates to housing, the lowest income, the highest acuity. How do we get them stable? Because they're expensive, they're hard to care for. And if we get their housing situation right, which is a very big challenge, we can actually save a lot of money and a lot of care costs and care challenges on the back end. But what we've missed, I think, is this forgotten middle in our focus on the most vulnerable, a much more easily tackleable challenge, but a challenge nonetheless, and an expensive one nonetheless. If you can appropriately house people that are over 65, you can save a lot. And so I think that our ability with new models and new thinking around this is starting to help springboard the conversation around housing as a social driver of health. And I think that's why it hasn't happened yet, but it almost feels like we're on the precipice of this movement towards housing as being kind of the most important social driver, and kind of these solutions being more ubiquitous in the market.
Great. Well, thanks, Jake. Just want to extend a thank you to everyone for joining us today. We've covered quite a bit of ground, and hopefully everyone found it as enlightening as we did presenting this. So if you had to step away or want to revisit any of this, we'll be sending out a recording to everyone soon. Feel free to connect with Jake either on LinkedIn or send him a message. I know we have a few other questions in here. We'll try to follow up with people afterwards as well. But thank you everyone for attending today.
Thank you very much, everybody. Have a great afternoon.